Well, what a great panel. Thank you, Keith. So I am to try to talk about next steps. So let me reflect on the last question. So I was trained as a physician. I did a lot of research. And today, this is what I do, which is, what about policy? What about whatever? I'm surrounded by, in this academy, 1,000 staff who's like this. Melissa, Katie, Emily, you name it. I mean, these are the young people who had 2, 3 degrees and they're working. So I think that the news is really good, in my opinion, with regards to what's in the future. I think what we need to do is provide a career pathway and a means of being able to advance. And that we have not done as well. If we continue to do this, I look at Keith. I mean, Keith is basically same, right? You dedicate your later career to this whole area. So there's tremendous opportunity, and we can make a difference. So I just want to summarize a few things and then really ask you to tell us what can we do next. So I think it's very clear from the discussion that what we need, as the report that Keith and committee put together, is that we need national vision and we need leadership. That's needed in terms of to create an equity framework. And of course, in their report, they refer to TP and government leadership to say, really put your effort together to advance this forward. And we're so lucky in the sense that we've had many conversations, starting with Londra Nelson, to Kei Kazumi, and of course to Erica, about how we can work along with NIH, along with FDA, along with all the other agencies, to start thinking about how we can pull this together. Now, you heard that there are ways in which we can enable this to happen. You know, there are levers that one can use if we want to create a culture of equitable innovation. The research funding, the publication, evaluation, academic promotion, tech transfer, and market incentives. So there's a whole range of things that we can talk about as we go forward. How to actually enable ourselves to use those levers. But I think it's very clear to me, to all of us, you can't do this alone. It's a collective effort. It's everybody, you know, from research organizations, scientists, research funders, to investors, regulators, payers, patent office, industry, healthcare organizations. So how do we bring all these sectors together and not try to do this alone, but together to make this difference? And how to implement it? How do we actually, as someone said to me, a lot of talk in this area of bioethics and social science about principles. How to convert principles into action, right? And Deborah showed you some examples of what we tried to do earlier. And I think what, at the end of the day, we believe what we need is a place where the right stakeholders come together, share experience, share ideas, and then kind of look at how we can move this thing forward together. So I want to open up for a few minutes discussion from your input based on what you heard, what the next step should be, right? And in kind of this outline, rich opportunity, creating a culture, creating a governance structure. How do we move forward? And you are the ones that can make it happen. So if I can just open up, anybody with a show of hands? If not, I'll call on some of you. Hannah, what's the next step?
You want me to jump in and buy you time?
Yeah, let him jump in.
Okay, you got it, that's fine.
Okay.
Let's pick, I'm very action-oriented, very concrete. I'm actually an engineer by training. Let's prioritize 3 things that absolutely need to happen in the short term. 3 things, medium term,
and bring everyone together to work on those three things. Terrific. Tim?
That was similar. I was just going to suggest we pilot, like maybe pick one thing and just start to do it, right? Just it's a crawl, walk, run, but use the convening power like you've done here, thank you, and get the cross sectors there, and let's continue to add sort of meat to the bones. We kind of did very light like discussions today in the breakout sessions, but what if we did that in earnest in a way with the brain power here on something of national or international significance? So to me, it's learning by doing.
Terrific. Gil?
Actually, we've had several mentions today about equity science and about figuring out what it is our goals are and how achievement can be measured. So what are the goals, what are the metrics, and how would they apply to different actors, of which there are many, but well represented in this program today? I think that would excite and mobilize the field. Otherwise, we'll just have unspecific statements of phrases.
Thank you for those comments. As a matter of fact, we are actually working on this along with Robert Wood Johnson Foundation to look at what, in fact, is this field and can we create a field equity science. Tony?
Thank you. My next step would be to take this show on the road to business schools and economics departments, because the cultural I'm having to speak this way. I'm trying to think about whose culture needs to change, and I think that we need to focus some energy and effort in really understanding how the kind of capital investment structure, that culture is very important. That's the one that needs some finessing.
Thank you. Keith?
So I like what Hannah said, but I think that we are in actually good position to not do those three things one at a time. Because different sectors need to change. And I think that we prioritize within the sectors, and that each get busy. The reason for this is that we can't wait anymore. There's real urgency. We don't start doing this right. We really don't want it right. And I think it's our responsibility to get it right. I think that the conversations in this meeting and the report and the SESI report all kind of lay out the roadmap for us to be able to do this in a multi-sectoral way and have each of these sectors sit down beside those priorities and start right away and be able to take parallel. Very much in the same way that you know, when we heard Marianne Pascata talking to Anthony a couple of years ago, she gave the example of NASA in Colorado, and the fact that all the stuff had to get done at once. Kennedy's projection for humanity in the 1960s. So they had to basically change the way that the government was operating.
That's right.
There's contracts with the lowest bidder, doing testing out ideas one at a time. He said, no, there's no urgency. We just have to go all at once. Because the problem is we're in a situation where it won't be hard to do that. We can divide by sector, have each sector prioritized, and then just start with it.
Excellent. Santa, you going to say something?
Well, I would say something similar, but also a little bit different. I think having a prioritization of what each sector needs to do is important, but there needs to be a broad steering committee with representation from each of the sectors to hold each other accountable, make sure that it's not haphazard and it's what's the word? There's alignment in the steps, so it's sensible. You know, and the vision, the new national vision should be published beyond the National Academy of Medicine Press, but in places like the New England Journal of Medicine or Science or places like that.
Okay, thank you. Yes.
Well, I don't know what has to be done necessarily, but I know that if something happens, it's never going to happen. We need the universities, and we need higher education to be free, and we need higher education to take the lead on this. And higher education is under a concentric attack, a lethal attack by the political world, by people that basically are trying to reverse us into what we were 3 centuries ago. And if we don't fight to have higher education free and able to find solutions that are logical and scientific, nothing that we are going to do is going to be able to solve the problem.
Thank you. Pacheco.
I think there's still a voice that's very missing from the table. Look around the room. We're not seeing the equity beneficiaries at the table, the patients, the communities, the rural health organizations, the Native American, Alaskan communities that really are clamoring for this and should be at the table co-designing, not just being the recipients of, these great ideas. So I think one idea is to really expand the convening with more engagement and representation.
Thank you for those comments.
Yeah, I think I would echo that. I was listening to a podcast when I drove down here, and one of Lincoln's quotes is that I destroy my enemies when I make them my friends. And we have a lot of people who don't believe in equity and including many rural populations, and I think we have to bring those people in to really make this work.
Thank you very much for your comment. The lady from Biogen.
Oh, thank you. Lauren Powell, Head of Health Equity for Biogen. I just want to echo again this comment here and add that I think an additional group that we are missing in this discussion is young people, very young people. I just turned 40. I don't know if I'm the youngest in the room, but I shouldn't be. So I just want to underscore that. So thank you.
Eric.
Yeah, I recently turned 40 also. I wanted to mention another group that's not represented.
By the way, Eric, my definition of old is anybody who's 1 year older than I am.
I wanted to mention another group that's not up here. It's not the group that you think of first, but because financial incentives are so important in health, payers, the government, but other payers as well, I think really need to be part of this.
Yeah, thank you. Yes, Holly.
Yeah, thank you. I was gonna say the same thing about incentives, right? So I think maybe Keith mentioned earlier today, right? We have really 2 levers that we're thinking about: regulation and incentives. I feel very confident that the philanthropies and the government are able to adjust the funding levers, but to the extent that we're seeing industry taking over in this space, right, that they're not having to rely on those sources of funding, we have to figure out ways for equity to affect the bottom line, right? And if equity was good for the bottom line, we wouldn't be sitting here because they would have already been doing it. So, we can look to models like the, orphan drug incentives, which, also have their critiques. Maybe they've gone too far in some ways. So you have to get the right type of incentives. I'm not confident that regulation at all is the way to go here, given our political system and capture, those types of things. I really think we're going to have to rely on economic incentives, and that might be a core priority to have people around the table thinking about what is going to move the needle financially.
Yeah. So thank you. Let me. Oh, yes, Erica.
Just
one more comment.
Two quick additions to the conversation, and thank you for leading this discussion. One ask I have actually back to the National Academies, having seen multiple of these conversations, these happen in silos. So we talk about promotion and tenure in one room, we talk about engaged research in another room, we talk about advancing equity, and to the extent that we can link these conversations, because we all end up kind of in the same place with the same recommendations for reform. So, I know, for instance, there's a building institutional capacity for engaged research workshop happening a month from now at the National Academies. How do we make sure they're building off of the conversation that just happened? So just wanting to make sure we are linking the collective efforts and finding our allies in this space.
Absolutely.
The other thing I would just advocate for is in thinking about building a community and next steps, there is a whole science and professional group and philosophy around building collaborative action networks and how to create a shared mission and set priorities. And I would just highly recommend working with the professionals in those spaces to think and design, like, what would a network look like? Who has to be in? How do you get buy-in? Because there's a whole kind of theory of design there that would be great to bring into this conversation in order to build an effective new community and network that drives progress forward.
Thank you. You just ended us in the absolute right place. Let me put it this way. You guys were invited to my party. Now you realize you all have to pay. The idea of a collaborative is exactly what you said, right? So I think if it takes everybody to do this, we need everybody in the room. And today, actually, we designed the meeting with the stakeholders in this room. Now, we're missing more community voices. I recognize that. And we may need more professional help to create this collaborative. But the fact is, we really are the neutral organization that should bring people together. Now, if you remember the beginning, we had actually 2 foundational work that's being done. And let's not miss that opportunity. One, of course, is what Deborah and the SESTI did to say we did get the different sectors together to look at how to govern, not regulate, to have the right conversation, to collectively move things forward. And second is the work done by the report in which we said we need to get everybody engaged to start embedding the whole idea of equity into everything we do. Now, so if you think about this last panel, we had universities, we have publishers or editors, we have private sector. Earlier, we have OSTP and other government, ARPA-H. I think we really have the basis of getting everyone together to work on this. Our next step should be, how do we get everybody to sit down, maybe take some of the priorities to say, how do we now commit ourselves to these areas? So when I look at Santa, for example, he belongs to the AAU, as I call it, Association of Universities, the key universities. I would imagine if he wants to join us, he should go and talk to all his peers at university to say, this is so important, right? And likewise, with others in the private sector, you know, to talk about their trade organization and how they can join us thinking through this. And of course, with the government sector, we already have lots of people committed to it. I think it's the opportunity is to move everybody together to create a collective solution, to look at where we want to go. And certainly, Deborah, in what you've done, we should pilot, right, your model, just as a tool to say, if you have emerging technology, horizon scanning you heard earlier, look at what it means and how to make decisions together and learn this. Maybe one day it'll become a, you know, standard, just like human subject protection, where we're all approaching the same way, right? And of course, culture is so important. So thank you so much for spending a whole day with us. I'm totally encouraged. I'm so energized. And you're going to hear from me, and we're going to get you involved and try to move this thing forward. So thank you very much indeed. There's a reception at the West Courtyard, West Court, which is out this way, turn left, go across the Great Hall, you'll be right there. And I'll see you all over there. Thank you.